Not sure what clinical information reconciliation is? You're not alone. This is a newer concept that goes beyond medication information reconciliation, where it talks about comparing lists of clinical information and being mindful of the lists of problems that a client has that would be on their problem list, diagnoses that may have not been followed through during changes in levels of care, allergies, procedures, and of course, medication. What we're looking for are through multiple sources of information to make sure we have a grasp of what the client is experiencing. And the reason why we know this to be a concern is because of harm that has come to clients. And it's for that reason that the Joint Commission has included medication reconciliation in the National Patient Safety Goals. So the goal is that in addition to the clinical information, we want to record and pass along correct information about the patient's medications, paying very careful attention on the differences between what is going on at home and what's going on in the facility, but recognizing that in and of itself doesn't keep the client from experiencing adverse events. In fact, sometimes it's the medication that has caused the adverse event. So nurses are responsible for understanding what medications are appropriate at all transition points. So when we say transition points, we mean upon admission to the hospital, upon transfer to the ICU, upon transfer to any specialty care area for any procedures or diagnostics or any surgical interventions, and alternate levels of care. So what that means is that we look at the client's problem list, their history, their medications, and we advocate not that medications match, but that the medication is the appropriate medication for the client's current situation. So it's very important to understand that just because they were taking the medication at home before doesn't mean that they should be taking it now. In fact, it could have been the adverse event that occurred from that medication they were taking. So that is, in a nutshell, what clinical information reconciliation is and medication reconciliation. What I want you to be mindful of is that we need a method to meet this goal in the facility. So what you'll see in different facilities are medication reconciliation forms, where we take their medications from home and we take our medications in the hospital, and then we develop a method for communicating with the healthcare provider. The method of communicating is just a way to seek clarification so that things don't get missed. So when we look at the client's home medications, hospital medications, we pointedly ask questions about the continuation of the medication, whether it should be included or excluded to seek clarification, any appropriate lab diagnostics that should be considered in view of that medication, and any current concerns that arise. So for every patient that we have in simulation this semester, we're going to complete a medication reconciliation form so that we have a communication tool when we talk with the healthcare provider.